Sleep paralysis, a phenomenon where individuals wake up unable to move, accompanied often by intense fear and sometimes vivid hallucinations, is more than just a bad dream. It's a fascinating interplay between the states of sleep and wakefulness. This condition manifests during the REM, rapid eye movement phase of sleep, a stage known for vivid dreaming, where the body's muscles are temporarily paralyzed. This mechanism prevents us from acting out our dreams but can lead to a terrifying experience if one becomes conscious during this state. The science behind the nightmare. During REM sleep, while the brain is almost as active as when awake, the body enters a state of muscle atonia, a protective measure to prevent us from physically reacting to our dreams. However, when this atonia persists as we regain consciousness, sleep paralysis occurs. This state is often accompanied by what are known as intruder and incubus hallucinations. Intruder hallucinations give the sufferer the intense sensation of a presence in the room, often perceived as threatening. While incubus hallucinations are characterized by an overwhelming feeling of pressure on the chest, sometimes with an aggressive or sexual context leading to suffocation and paralysis. What triggers sleep paralysis? Though direct causation has not been firmly established, several factors have been associated with an increased risk of experiencing sleep paralysis. These include anxiety disorders, poor sleep quality, substance use, exposure to traumatic events, and even a family history of the condition, suggesting a potential genetic predisposition. Who is at risk? Sleep paralysis is estimated to affect around 7.6% of the general population, with a slightly higher prevalence in females. Though it can start at any age, most individuals first experience symptoms in childhood, adolescence, or early adulthood. Interestingly, non-white populations and those with psychiatric conditions such as anxiety or depression are reported to have a higher incidence of sleep paralysis. The pathophysiology of night terrors. The exact mechanisms behind the terrifying hallucinations of sleep paralysis are complex. During REM sleep, the body's respiratory muscles are less active, leading to irregular breathing and reduced oxygen intake. This, combined with a hypervigilant state of the brain originating in the midbrain, contributes to the feelings of fear and the presence of hallucinations. Moreover, flaws in the brainstem structures that regulate REM sleep may also play a role in the occurrence of these episodes. Diagnosis and management. Diagnosing sleep paralysis involves recognizing its characteristic symptoms, often through patient questionnaires designed to identify triggering factors. While there's no treatment to stop an episode once it starts, strategies like improving sleep hygiene, addressing underlying psychological factors, and certain relaxation techniques have shown to be beneficial. Focused attention meditation combined with muscle relaxation therapy has also demonstrated some promise as a direct intervention. The importance of education and early intervention. Educating patients about the benign nature of sleep paralysis is crucial. Understanding that the frightening hallucinations are not real can significantly reduce the fear associated with episodes. Early recognition and intervention, especially addressing any coexisting conditions like narcolepsy or anxiety disorders, are key to managing sleep paralysis effectively. In conclusion, while sleep paralysis can be a distressing experience, understanding its nature, potential triggers, and management strategies can greatly alleviate its impact. As research continues to unravel the mysteries of this condition, it's hoped that more effective treatments will emerge, offering relief to those who navigate these shadowy borders between sleep and wakefulness.